Hi everyone, thank you for joining me. Today's topic is going to be on the role of mold in chronic illness, and I'm going to try to give you some basic concepts and reviews maybe for the first 15 minutes, and then we can take some questions as we kind of cover the things I know that a lot of people have questions with already. Now, mold is one of these things that there's some issues with it and some concerns with it as far as what's available for the healthcare system and what our patients face when they have a mold related illness and so forth. So the first basic concept is that mold releases things called mycotoxins, or aflatoxins specifically is one type of mycotoxin, and then these compounds tend to trigger an inflammatory response in some people, and there's also various things that may have an impact on how severe the reactions may be for one person or next. So one principle is not everyone has the same reaction to mold exposure. And part of that could be due to what's called immune tolerance. I've written several articles about that on my website, drknews, drknews.com, and that's associated with how your immune system is fit to react or not react against an environmental pathogen, the integrity of the lung barrier, and also that there seems to be some genetics involved, right? Some people react to certain mycotoxins from mold than other people. Now, one of the key things that I think a lot of practitioners face, a lot of patients face, is the frustration of why doesn't anyone know how to treat mold, and why am I, if you end up with a mold toxicity, or let's say illness from mold would be a better word to use, why am I having a hard time getting anyone to believe me? Why am I having a hard time getting any kind of care? Well, there is a research gap between what practitioners see and what's been published. So to be quite honest, there really aren't a lot of great research studies out there. It's very clear that mycotoxins can cause human illness. But as far as how to diagnose it, how to treat it, how to manage it, what kind of strategies to use, there isn't much published on that. So I think for even, for the average physician that's looking at what's been published in evidence-based medicine, there's a gap there. So it's not like everyone's ready to jump on board because, to be quite honest, the people that work with mold on a regular basis haven't done a lot to publish about it, and this isn't in the area of a lot of research enthusiasm right there. So we have this gap. Like, we don't have any clinical trials of how to effectively treat mold anywhere in the literature. Some people have published some case reports and some studies like that, but nothing to really be compelling for a dramatic move in the healthcare system. So I think that's one of the things you should know as you walk in the healthcare system with that issue. Now, everyone knows that there can be some issues with mold, that people can get mold-related illnesses, but also has really caused some significant litigation, and so there's been some hesitation to really jump on board with some political reasons with it as well. So it's a combination of all these factors, but at the end of the day, what happens is that there's a lot of people that have their own immune uniqueness that makes them sensitive to mold. And then when they get sensitive to mold, they start to have a whole list of inflammatory symptoms and reactions that are very diverse. And then they tend to be very frustrated and want to figure out what to do with it. Now, remember, one of the key concepts is that not everyone's going to respond to mold the same way. So you could have someone that walks into a very damp old building with mold all over the place, and they're fine. Someone else walks in the first 2 minutes and their asthma flares up and their eyes get teary and they feel sick and they don't feel well for the rest of the day just from a short exposure. So same building, same environment, but completely different reactions. So that's one of the things that is a part of the concept of mold. There's also another thing that's important to understand. There's a difference between mold and mildew. Mold is typically green-black, and there's actually not all species of mold produce mycotoxins that significantly impact human health. So even some of the black and green mold that's out there isn't necessarily toxic. Some species are. That's why testing is important. And then mildew is more like gray and white, and it also smells. So like if you go to an old building that has mildew on it, it'll smell funny and not be pleasant to be in, but it's not necessarily toxic mold or releasing these mycotoxins that are very damaging. So the ones we're really worried about are the black mold and different species that are involved with that, like Aspergillus and Stachybotrys and so forth, that really can cause some reactions. Now, I can tell you just from a practitioner, and I think all practitioners that work with chronic diseases will absolutely have patients come in and tell us that I was healthy, and moved into this building. There was a timeline, and I got really, really sick, and they came in and tested mold, and then I felt a lot better. Another common thing we hear in medical histories is, you know, I feel better when I leave my house. I feel better when I travel. I went on a vacation for 2 weeks, never felt better. Came back home, started to crash slowly day by day. Those are all indications that there could be a mold-related issue. So we know that mold can grow in damp. We know buildings have been exposed to humidity and water, and then you can have these species grow, and that can create some health problems. Now, there was a very interesting study that was published in Frontiers in Immunology back in 2017. It was a Finnish study, and what they did is they monitored two different cohorts. One was a family of 9 people that lived in a mold-infested building and felt like that was fine, that there was no health issues, and they wanted to stay there, and they agreed to be monitored for the next few years. And then they also did the same thing to an old school building with 50 students and 30 teachers, and they wanted to look at their symptoms and get a baseline and monitor them over a series of time. And they really found some very interesting things. They found not everyone reacted, some people reacted, but for the most part, they would see people develop this phenomena, which is really important to understand if you're being exposed to mold, between immune exposure to mold and immune reactions to mold versus what's called mold sensitization or mold allergy. So when we get exposed to mold species and we start to have immunological reactions against them, then those reactions produce antibodies, and we can measure those in the blood, and those are called, IgG antibodies, for example. And that lets us know that the immune system is getting exposed to these toxic mold species, and the immune system is probably going to have an inflammatory reaction to them. So it's a simple blood test in the clinical setting that can be done to measure that. Now, that's different than what the study found, is that some of these people then get sensitized, and then they get into an IgE reaction. An IgE reaction causes immediate symptoms, and at this point they become primed, what's called sensitized to mold, and some people call this mold allergy, where at that point, anytime they get exposed to mold, they're going to feel sick. So for those people, they can walk into a building and immediately get sick if there's any kind of mold spores, and typically it's old damp buildings they walk into, and that seems to be an ongoing permanent thing because they've changed their immune response, where they have this IgE, immediate immune response shift in their immune system. So, one of the things, when people have reactions to mold in a clinical setting, we're always thinking about, okay, well, is this person just have some exposure like IgG, or they have IgE? So if I have a patient that comes in, for example, and they tell me that they've really gotten sick and they really think there's mold in their house, and they've actually had it tested and they can see it visibly, my first question is, are they having an IgG and IgE reaction? And that would let me know how to determine their prognosis down the road. So some people just have some reactions, and some people then develop full-blown sensitization to mold. And unfortunately, the ones that develop full-blown sensitization to mold, they seem to have this ongoing issue, and the best you can do is to try to calm down their inflammatory response, try to improve their immune tolerance, and hope that they can react for it. I'll get into some treatment applications before I take some questions, but I just wanted to really expose you to some of those concepts. Now, the other thing I want to talk about is, besides this Finnish study, is that what they found is that if they kept people in these mold-infested periods, that was one of the key factors, these mold-infested buildings, that was one of the key factors where they actually shift from IgG to IgE. Now, one of the things to also add that is important to understand when you look at mold research and mold mechanisms, there's a mechanism of pulmonary epithelium permeability. It's called, you can simplify it, it's kind of like leaky gut, but it's leaky lung syndrome. They don't call it leaky lung syndrome in the literature, but it's basically the same concept of leaky gut. So let me explain and correlate how these two things work. So we know that when people get chronic inflammation in their gastrointestinal tract, their intestinal tight junction proteins break up. Now, these are zonulin, occludin type junctions, and undigested food particles go through, and that creates a significant inflammatory reaction. And then people that have, like, for example, genetic susceptibility to some disease like celiac, if they get exposed to gluten, they get serious destruction of their intestinal barrier, they get leaky gut, and then they perpetuate autoimmune diseases over a period of time, as an established model in the literature right now. Now, we also know that there's people that don't have to have celiac disease, but they just get exposed to chronic foods and chronic inflammation in their gut, or they have an inflammatory bowel condition, and they also get intestinal permeability, and they start to react to food proteins, and all of a sudden they're reacting to all these food proteins. Well, similar mechanisms take place in the lung and within the lung barrier. So there's a pulmonary epithelium barrier, and the pulmonary epithelium barrier has also zonulin proteins that keep the epithelium tight together. They also have proteins called claudins, and there's different claudin versions, like claudin 4, 5, 6, 3, but all they do is they just keep the intestinal epithelium junction of the lungs together. So things like mycotoxins, just things like air pollution, things like cigarette smoke, tend to break these junctions down, or any inflammatory mechanism that injures the lung epithelium can break down these barriers, and now the person has these barriers open. So it's possible that people that get chronic exposure to mold that's releasing mycotoxins have this, they breathe this in, this inflammatory response starts to break down their pulmonary tight junctions, and as these pulmonary tight junctions break down, they open up, and now they become extremely sensitive to things in the air. They start to get asthma, they start to get systemic inflammatory responses, because what they're breathing is now causing an immune response. So in the pulmonary epithelium, we also have dendritic cells and different types of immune cells that then trigger an inflammatory response that becomes systemic. There's a whole host of symptoms that people get with these lung barriers open up. So just as the gut barrier can open up and promote autoimmune disease, which has been established in animal models right at this point, we know that if the lung barrier opens up, it's really the same thing, but instead of getting the exposure from foods, you're getting it from things that you breathe in. So we know that chronic exposure to mycotoxins could be a factor why some people end up with pulmonary permeability, and when this pulmonary permeability or leaky lung happens, just like leaky gut, they can develop chronic inflammatory conditions and even develop autoimmune diseases. It's not so much from their gut barrier, but it's from their lung barrier. So those are some important mechanisms that are involved. I think my volume is still low.
Yeah, for some people.
I just want to mention something about the volume. A lot of times what we found is the volume is really associated with your own internets coming into your system, and not as much from our output. But anyways, so you can see people that are posting comments. Some say I can hear you fine, some say speak louder. There's nothing more I can do other than my mic and speaking, but we will clean these up and post them. So if there are problems with sound, please hang in there, and we'll clean these up and edit them and post them, so there should be no sound issues in the future. But most likely, if you can't hear, it's really from your server or your input into your speaker. Okay, let me move on. So anyways, when you're looking at mold, by the way, when you're looking at these reactions, so this lung barrier breaking down is very similar to gut, these leaky gut patterns. This is one of the things that happens. Now, one of the things that is also clear is that when people start to have these inflammatory reactions in their lungs, some of the most common symptoms are like asthma, difficulty breathing. When they try to work out, they have a hard time recovering, and they may also notice coughing, irritation, and so forth. So, then the question is, okay, so this exists, what's out there, and you can test for it. You can also, by the way, measure urinary mycotoxins, and most labs will measure antibodies for mold, like LabCorp or Quest. Some people, if they want to measure mycotoxins, they have to go to a specialty lab. One of my good friends, Dr. Andrew Campbell, just opened up a lab called My Myco Lab. It's something you might want to check out if you want to learn about mycotoxin testing, and also reactions to mold that way. But the key concept is you can measure mold antibodies and mold mycotoxins and determine what's happening. Now, for some people, when they get exposed to these mold spores, they breathe these mycotoxins in, and these mycotoxins are very resistant to They're very resistant to temperature changes, they're low molecular weight, they hang in there and they cause inflammation, and then they do show up in the urine. So people can measure those and see if they're still getting that exposure if they're concerned about it. one of the key things about any kind of mold related issue is the environment. As a clinician, you see people sometimes say, well, what do I take? What nutritional supplement I take? It's not necessarily taking something. If you don't remove your exposure to the mold, you can't beat it. There's no supplement that's going to counteract that constant mycotoxin exposure. It'd be almost like saying, I have celiac disease, I still want to eat gluten, so what supplement can I take to still do that? And that doesn't really work. So the key thing is you have to have ventilation. That's a key factor. And there's mold remediation contractors out there that deal with cleaning up damaged buildings, and they can come into any home and test for air quality and so forth. So the key thing is first identifying if that exists. If someone has reactions to a mold with antibodies, that means their immune system is having an inflammatory reaction to mold species. And then the next question to ask is, has it gone into an allergy or a sensitized state where they're making IgE? That's a whole different set of outcomes. And also, are they producing high amounts of mycotoxins, which are inflammatory mediators that can be involved with that. Now, when you're looking at exposure to mold also, and mycotoxins, some people could be in the same building as someone else for many years. They could have one family member or one person, a student in an old building that's getting exposed to mycotoxins on a daily basis, and another one, and they have no symptoms, whereas another one starts to develop symptoms pretty quickly. And one of the concerns with that, one of the mechanisms behind that is basically their immune tolerance. And immune tolerance is really a combination of how healthy are your blood-brain barriers, lung barriers, gut barriers, how active are your dendritic cells, what's going on with cells called Treg cells. I did create a program about immune tolerance. If you go to Dr. K News, it's like an online program that talks about that. But let me give you one part of that, which is really important when it comes to mold. And this is specifically to the lung pulmonary barrier. So our bodies are constantly getting exposed to different environmental compounds and different pathogens and different things to impact or cause inflammation in our surface. So air pollution, cigarette smoke, mycotoxins, they're all degrading our pulmonary barrier to some degree. So we have some breakdown of the barrier. But what's also important is how quickly you can regenerate that system. So antioxidants are a really key part of that. So there's sometimes situations where someone's reacting to mycotoxins, but they can't leave the environment for whatever the reason may be. So you really want to, at the very least, in those situations, improve their immune tolerance, but for sure try to improve the integrity of their pulmonary barrier. So things like vitamin A are really critical to help the pulmonary epithelium regenerate. Antioxidants, all types of antioxidants, can be useful to prevent mycotoxin destruction of the barrier. So high amounts of different types of mycotoxins like acai extract, pomegranate extract, those types of things are important. Glutathione, things that raise glutathione like N-acetylglutathione, or actually taking things like liposomal glutathione, can all be effective strategies to try to provide antioxidants to protect barrier breakdown if a person is getting exposed to mycotoxin exposures and so forth. Now, there's some, and I know people can ask about clinical strategies and what to do, so I'm going to finish this last section here and take some questions, but I want to talk about clinical strategies to consider when you do have exposure to mold. So the very first thing is, if you have exposure to mold and you feel that mold has made you sick, is ask the question, are you constantly being exposed? Or are you a person that has now been sensitized to mold and have IgE reactions where no matter what room you go into, or what damp building you go into, you're going to have a reaction? And those are two different expressions of how mold impacts people. So one is just causes an acute inflammatory reaction, but hasn't been sensitized into IgE or mold, so-called allergy, or mold, or ongoing chronic mold sensitivity, or not. Now, ultimately, despite which form you have to really avoid damp environments. So one of the things I use in my patients is I use something called a hygrometer, which measures indoor humidity. And for people that are sensitized to mold, you really want to get a hygrometer and measure the humidity of your rooms, and you definitely want it less than 50%. And if you can't get your room less than 50%, if you have sensitivity to mold, you should get a dehumidifier. And then dehumidifier can help reduce that humidity, because that humidity will trigger people that have this IgE reaction to mold to have this aggravated response. The other key thing is really have healthy ventilation in your rooms. That's really critical. And then if you do have any concerns with mold or have mold issues, you definitely want to get an air purifier, and it has to be a HEPA filter to really be able to remove mycotoxin compounds. So a certified HEPA air filter, dehumidifier, hygrometer are all things you can use to reduce your immune reactions if you've already developed mold sensitivity. Now, in the field of nutrition, there are lots of different clinical approaches, and I got to admit that these have not been vetted through clinical trials or have been tested. And this is where some of the pushback comes in with people that are looking for, what do you mean you're treating mold with nutraceuticals or botanicals and so forth? And I think this happens a lot because patients need to feel better, and so there's been some strategy and protocols people use. But, we still don't have these clinical trials to show the evidence that these things actually do work. So part of it is anecdotal for the most part. So when people have mold issues, there's certain natural compounds that seem to have antifungal, anti-mold properties. Things like tea tree oil, things like oregano oil, things like clove, things like thyme. Those can all be taken as botanical extracts to kind of support that. They're also what are called biofilm disruptors, because as you get injury to your lung epithelium, you start to have these mycotoxin species start to stick together and develop a protective film, so you have a hard time getting rid of that inflammatory immune response. So those things are natural compounds that have some properties to support those systems. Sometimes people use what are called binders. Binders are there to kind of bind to the mycotoxin so it can be cleared from the body. Cholestyramine is a drug that is really the most powerful one. People have used that in different mold protocols. It's a lipid sequestering anti-cholesterol drug that was used a long time ago. It binds to bile acids, but it also binds to different toxins. But from a nutritional point, things like zeolite, things like activated charcoal, there's various clays out there that people use as a binder as an attempt to get these things out. Supporting the pulmonary system with lots of antioxidants like glutathione. Nutritional support for the lung barrier, vitamins A, D, and K, they're all important. And then a strategy to really improve immune tolerance. And the strategy to improve immune tolerance I call the 3D immune tolerance program. This is a term that I use for the program I developed. It's called diversify. It's the 3Ds stand for diversify, which is how to diversify your microbiome. The more diverse bacteria you have, the better tolerance you have in your overall immune response. Downregulate, how to downregulate activation of dendritic cells and T cells that cause a response. And distinguish, how to really improve your immune system's ability to distinguish pathogen or not. There's also some people that have had some success with using mold desensitization therapy, where they give little small injections of different mold compounds to start to get their immune system to respond to it. There's been some success with that as well. You can also use like nebulizer to breathe in oils like tea tree oil or sea salt to help try to get some of the anti-mold properties into your lung system. There's also different what are they purifiers with oil. You put the I'm asking my wife.
I'm not paying attention. Sorry.
Mold. Anyways, you can use different essential oils and they release the oils in the air.
Oh. It's downstairs. I can't think what it's
Okay,
called.
I can't remember what it's called. Someone can help us.
Question,
But
sorry.
you put those, you put the oils in, and it just releases in the air.
Okay.
Those are very useful. So those are like the basic concepts between how you can do things to support mold. So I try to cover the basics for you, and I know those are the typical questions that people ask. So let me try to go through and take any questions that people have, and see if I could.
Someone's asking me the exact name of the meter. I don't know what meter that is.
The exact name of the meter to measure humidity,
Mm-hmm.
it's spelled HYGROMETER. And you can get this hygrometer at Amazon. They're like $15-20, not very expensive. You can put one in every single room if you want. But that's one way to measure humidity. And if those levels are above 50%, and you have sensitivity to mold, you definitely want to get a dehumidifier to decrease the humidity, so your reactions are less or suppressed.
Okay. Can you please repeat the name of the new mold lab?
Yes, the new mold lab is called Mycolab, MYCOLAB. The director is Dr. Andrew Campbell. He's a brilliant environmental medicine physician, and you can just go to their website, which I believe is mymycolab.com, to find more information if you're interested in that.
Okay. Sorry, something's wrong with the
The question in from Savannah: do specific binders work better for specific mycotoxins? Well, the whole concept of binders for specific mycotoxins has not really been investigated, and I think with everything in natural medicine, when you start to use them, then practitioners will have different preferences, and but there's no clear evidence one works better than the other. So you'll have some practitioners will love something like zeolite, some will love activated charcoal, some will prefer various binders.
It's a diffuser. Shane Sedman chimed in and said it's a diffuser.
Thank you. The diffuser, by the way, where we couldn't remember the name of how this essential oil gets into the air, is a diffuser. So
thank you, Shane.
Thank you. I think we have our own mold-related brain toxicity.
It's all these.
Okay,
sorry.
diffuser.
Okay.
Thank you. Okay, next question here.
Hold on. I found pomegranate seeds seem to break up biofilms. Is that accurate?
So,
seems to.
Who's that from?
Mark Will.
So Mark asked, he found pomegranate seeds break up biofilm. Is that accurate? I'm not sure if pomegranate seeds are biofilm disruptors, but if they are biofilm disruptors, that's new to me. But pomegranate is a very powerful antioxidant, and it can preserve integrity of barriers as an antioxidant, lung barrier, gut barrier, and so forth. So it's definitely one of the things to consider if you're getting exposed to environmental chemicals, is a really powerful antioxidant, and pomegranate extract is one of my favorites. I think it just is such a powerful superfood, super botanical, and very, very high what they call ORC values for antioxidant activity.
Okay. Katya, do saunas help?
Katya asked, do saunas help? I don't know. Some people that are really sick, they go to saunas, they just completely crash. They can't handle it. There's a significant impact of stress that happens to the immune system when you drastically change temperature. I mean, theoretically, the concept being if you sweat, you're getting rid of toxins and so forth. But at the same time, the challenge of a significant change in temperature does impact thermoregulation systems, and some people that are chronically sick just don't feel well with it. And some people say, well, that's just an immune, toxic reaction. They're getting all this stuff out, so they feel worse. Maybe not. Maybe it's just that the drastic changes in temperature have a direct impact on the neuroendocrine immune system. And immune regulation is a serious thing, and you can actually tax your immune system and your function and your antioxidant reserves when you actually do crash. So I really am not a big believer in thinking that you should go in a sauna and then completely crash, and that's okay because that's how you're getting rid of toxins. I really think that at that point, for some people that are really sick, getting into a very hot sauna and completely crashing is going to actually shut down their antioxidant function and the reserves, so it may not be the best idea. You might want to try other types of approaches. But the general concept in the world of natural medicine is that when you have toxicity, you want to obviously sweat as much as possible, have healthy amounts of bowel elimination, urinate, health. You obviously want to sweat, have normal bowel movements, and have healthy hydration, so you can urinate and get all these compounds out. So there's basic concepts of human toxicology.
Okay, Erin asks, is the urine test accurate? My functional med provider is suspecting mold is an issue for me, but she wants our environment tested first.
So the question is urinary mycotoxins accurate? So this is actually a really good question. There is the possibility that you may not actually have mycotoxins that are significantly in your system causing them, but you may have just been exposed to food particles that have some mycotoxins that show up on lab tests. So it's not really toxic mold you're breathing, but there's some degree of mycotoxins on foods that's stored in bins, or things like grapes, things like even coffee beans, things like corn, things like wheat. Anything that's stored in bins may have an impact on changing those mycotoxin levels. So you really want to look at the history and the big picture and see what's useful to you. But there are some concerns about urinary mycotoxin accuracy and how much of those mycotoxin readings are really just from some exposure to foods versus mold that they're breathing in from, let's say, their environment.
Okay. Tiffany, if you test positive on a prick test for mold allergy, is that IgG or IgE? Does it mean you have an immediate reaction?
So the question is, if you test for a pinprick from mold allergy, is that IgG or IgE? Well, all skin prick tests are IgE. So if you react with a skin pinprick test, that means you have IgE activity, which means you may have this sensitized immune system now to mold, and that would be probably one of the best therapies that you might be a candidate for, is to consider where they do mold desensitization therapy with little injections of the diluted antigen. You still want to improve your immune tolerance. You still want to build your antioxidant reserve. You still want to reduce at that point, you definitely want to reduce your exposure to any mold, and you really want to make sure that you check the humidity of your house and have a HEPA air filter. But the skin prick test will be an IgE reaction.
Okay. So Mari says, I have Hashimoto's and mold and SIBO. Do you see them being related? And if I clear the mold, will my Hashimoto's get better?
The question is, I have Hashimoto's, I have mold exposure, and SIBO.
Yeah.
And if you clear the mold, will your Hashimoto's improve?
Yeah.
Don't know. You never know. So clinically, when you look at most patients that have chronic autoimmune disease, they have multiple things happening like that. So obviously, if you have mold exposure, that doesn't necessarily mean that it's an ongoing issue. I mean, all of us have some degree of mold exposure. The question would be, do you have do you currently have antibodies to mold? Are you still getting exposed on a daily basis? Or do you have like an IgE response to mold? Those are all the key factors. Now, mold exposure itself can be a trigger because it's creating these mycotoxins that are causing an inflammatory response, but it doesn't necessarily mean you get chronic illness. So remember, the people that get exposed to mold that are never the same afterwards are the ones that get sensitized and then develop these reactions. So if you have Hashimoto's, you could be the one that has just an acute reaction because you're getting exposed to mycotoxins that are causing the inflammatory response, or you may have progressed into those that are sensitized, have an IgE reaction, that are always sensitive to mold. And if that's the case, then you have to constantly deal with mold to calm down the expression of your immune system so you don't flare up your Hashimoto's. If you just had some exposure, you don't have an IgE reaction yet, then the key thing is really to remove your source and see if you can improve the integrity of your pulmonary barrier by raising your antioxidant levels and glutathione levels and vitamin A levels, and just making sure you have a good HEPA air filter and are breathing good quality air so you can let your lung barrier heal. And I think with autoimmune disease, there's been such an emphasis on the gut, and the lung barrier is a key factor. And also, I would say, in some recent studies that have been published with the prevalence or the outbreak of COVID-19, they found in areas that have the highest amounts of air pollution, like Paris, like New York, like different regions of Italy, where there's so much smoking, so much car exhaust, and such poor quality air, that they're seeing these outbreaks. So there are some researchers that are theorizing that a potential mechanism may be how people react to, for example, the current coronavirus strain, is that if their barriers are compromised, that they can end up having greater outbreaks in those regions with people that have those air pollution issues. Okay, next question.
Okay. Okay, pause. Sorry. Someone's asking about Dr. Shoemaker being accurate, and I'm trying to find the response. Do you know Dr. Shoemaker?
Yeah, Dr. Shoemaker has his own protocol for treating mold. I think he's helped a lot of people with that. It's definitely something to look into if you have a mold illness. And he's doing some good work to try to get some information published about what he's been doing. So so those are things to definitely look into if you're dealing with it.
Okay. This is off topic. If somebody, oh gosh, here we go. It could be from. I'm sorry.
Question here is, what glutathione source do you use? So when you look at glutathione, there's different types of glutathione sources out there. We actually made a whole video on glutathione. I personally prefer a liposomal form of acetylglutathione. That seems to have the best approach. But sometimes if you're just trying to raise glutathione, the easiest way to do it is just to use things like N-acetyl and acetylcysteine.
Okay. Kate Flanagan. Cleveland Clinic did a systemic blood lab test. Oh, no, I'm sorry. These are just not good. What is the best mold test? After how long after exposure can tests still find do you have reactions to mold? Months, years, etc.
So the question is how accurate are mold antibody testing and for what period of time?
Asks, what is the best mold test and how long after exposure can tests still find that we have reactions to mold?
So reactions to mold, if you have reactions to mold, if you have antibody productions typically last somewhere between 2 to 6 months. So any exposure to mold in a 2 to 6 month window would be something you can look at. IgG is just telling you that you're having a acute response, your immune system is reacting to mold. IgE is telling you that you were sensitized to mold. And I think for the most part, as far as when you're looking at these antibodies, you're going to get exposed to mold all the time. So you're going to, you're going to be able to tell if your immune system is reacting to them or not. And that's the key thing. So the other thing to point out is if you do feel sick and you are having these reactions, you do definitely want to check the air in your home and have someone that does mold remediation come in and check the air quality and see if there's any areas. Obviously, sometimes it's very obvious because you can smell mold in certain rooms if you have any water damage. But I don't think you have to be too concerned about the length of time with the antibodies. You'll be able to see them because we typically get exposed all the time. Okay,
Joy. Is VCS testing accurate?
Is VCS testing accurate?
Yeah.
I'm not sure what VCS testing stands for.
I don't either.
So I can't answer that.
Okay. Arlie, what about red infrared therapy instead of sauna?
Red infrared therapy versus sauna, to be honest with you, I don't have a good answer for you. I hear about that myself, and I have some patients that swear by it and some patients that feel like it hasn't done anything for them. I think there could be some uniqueness if that kind of therapy works or not. There certainly aren't any studies published on it, so we don't have that to count on to look for. So all we have is some anecdotal information, one person to another. I don't have enough experience with it myself to give you a personal opinion on it, so that's the best I can do to answer your question with that.
Okay. Is there any other biotoxin similar to mold toxin? Boris is asking.
Are there similar other biotoxins?
Is any other biotoxin similar to mold toxin?
Yes, there are other similar biotoxins similar to mycotoxin. The most common one is just what's called lipopolysaccharide. This is gram-negative bacteria produces this biotoxin, and it's one of the main reasons why intestinal permeability can make many people very, very sick. So when people have intestinal permeability, this gram-negative bacteria takes place, especially if you have dysbiosis, is released in the bloodstream, and then this biotoxin binds to what are called toll-like receptors, and specifically toll-like receptor 4, and that tends to cause a systemic inflammatory response throughout the body. So mycotoxin could also bind to what are called toll-like receptors, which are little receptors on immune cells, and when they bind to them, it triggers this inflammatory cascade. That's why the symptoms of any kind of biotoxin or mycotoxin exposure causes a diverse list of symptoms, because it really turns on inflammation throughout the body. So depending on your pre-existing inflammatory state, you may get different symptoms when you get exposed to a mycotoxin or a biotoxin, because it basically adds fuel to the fire. So if you already, if you've had a brain injury and you've had some inflammation in your brain and you have some prime glial cells, for you get a systemic inflammatory response. It may really shut down your brain function. For someone else, they have RA, or they have early rheumatoid arthritis. They get inflammatory response and their joints start to hurt from the mold exposure. For someone else, they had a knee injury that never really healed, and for them it just really causes significant pain there. So biotoxins or mycotoxins really just turn on toll-like receptors throughout the entire body and different immune cells, and then you just create inflammation. But one of the key things that clinically determines symptoms is where is the inflammation before the exposure.
Okay. Jonathan, how can we improve lung barrier?
How do you improve lung barrier? I talked about that a little bit earlier. The best ways to improve lung barrier is to have good air quality. So you definitely, I think everyone should invest in a good air filter, air purifier in their home, especially in their bedroom where they're constantly breathing air. That's always a good idea. And then from a nutraceutical perspective, vitamin A is really critical for the lung epithelium, and just a high rich source of antioxidants in your diet, or even if you want to take antioxidants preventively, nutraceutically wise, the whole list of things from pomegranate to pine bark to acai to resveratrol to turmeric, they all have very good antioxidant properties. So those are the key. And then again, glutathione, whether it's liposomal glutathione or things like N-acetylcysteine, are pretty good strategies to improve the lung barrier. One of the things I also do just to in my office is I have patients take in several deep breaths like that over and over again, and I have them do about 5 of those, and I want to see if they cough. And sometimes when people have some compromise of the barrier, as you kind of vacuum particles in and across the lung barrier, if there's any kind of inflammation there, you start to get a coughing reflex. It's not the best test. It's just, when you don't really have a lot of good laboratory markers, it's just one of the ways to suspect it. So obviously the exposure to mold and the timeline when they got sick would be the best scenario, and it's pretty likely that if they are having reactions to mycotoxins, that their pulmonary barriers can be compromised to some degree.
Okay, Selena, what is the best way to downregulate T cells / dendritic cells in situations where mold is a problem?
What is the best way to downregulate T cells and dendritic cells when mold is an issue?
In situations where mold is an issue, yeah.
So the best ways are really to, first of all, decrease your exposure, and then secondly, these dendritic cells are very also dependent upon vitamin A. There are retinoic receptors that make their efficiency more efficient when there's high amounts of vitamin A. And really the other key thing is to A and D also are critical for A and D are critical for the dendritic cells and regulatory T cells, and really trying to improve diversity of that system. Once again, I made an entire online program called the 3D Immune Tolerance Program that you can take a look at too, and I go into all the mechanisms and research in much greater depth if you really have interest in those strategies for immune tolerance. But I think I've covered some of the most fundamental things in this talk so far, so you don't need to buy it. It's just something there if some people are interested in learning at it, but it is a good way. I also have a free immune tolerance program on our site called Dr. K News, which can be useful as well.
Okay, Jackie asks, what are good biofilm disruptors?
So what are good biofilm disruptors? So for the most part, the common things that are biofilm disruptors are things like garlic extract, wormwood, black walnut, berberry, uva ursi, olive leaf extract. I think is probably one of the best ones. But those are all typically, all basically biofilm disruptors. So all of those, any one of those could have some impact on breaking down the biofilm.
Okay. Dee, can you comment on the C4A serum test in diagnosing mold?
Can I comment on the C4A
serum test in diagnosing mold?
Oh, I think the C4. I think you're talking about the complement protein test to diagnose mold. Yeah, this is terrible stuff. There's such bad science out there. just because you have a raise of any of the CD4 proteins or complement proteins has no specificity for mold. It just means your immune system is getting exposed to something. You typically will see activation of things like complement proteins when people are dealing with mycotoxins, but it's not specific for mold. But it is. So it's a finding you see with people that have exposure to any kind of any kind of pathogen or any kind of immune activation pattern. Complement proteins are kind of like landmines, and there's different complement proteins, C1, C2, C3, C4. There's no specificity for any complement protein for any kind of pathogen, so that's why you can't use it to diagnose it. But if you do have someone who has exposure to mold and you look at their complement proteins, whether it's C3 or C4 or whatever the protein may be, you can use it as a baseline, and then as they reduce their exposure and improve their immune integrity and their immune health, then you can use this. You can look at that to see if their complement activity is starting to calm down, which would be a clue to you that their immune system is not being as activated from those responses. And the good thing about the complement proteins immediately change when they're not reacting to pathogen, whereas antibodies, will stay elevated for many months, so they're not as reliable to determine if the immune response is improving with any kind of strategies to remove the exposure and to improve the immune system. So the complement proteins do have their place, but they're not used for diagnosis. They're used to kind of determine some degree of immune reactivity when someone has already been established to have any kind of mold issues.
Okay. Susan asks, can you repeat the 3Ds in the 3D program?
The 3Ds in the 3D program. So let me add to that. Something that I've been working on for a very long time is something called immune tolerance. And one of the things I found with patients that have autoimmune diseases and have chronic inflammatory issues is there's really this dysfunction that's been published in literature as loss of tolerance or immune tolerance. And then my next question throughout my career is what is causing people to lose their immune tolerance and how do you reestablish that? And I came up with that there's really 3Ds that are involved with what's published on there. One is to diversify. And diversify really has to relate with your microbiome. So the more diverse your microbiome is, the healthier your reaction is to whether to react or not react to environmental triggers. So diversity comes from eating lots of diverse foods, but your diversity can also change from taking lots of antibiotics. Your diversity can also change from sedentary lifestyles. So lots of things impact microbiome diversity. But the goal is to really try to improve your gut diversity as much as possible. The second D is to downregulate. So downregulate means that when you have someone who has an activated immune response, their immune cells are upregulated. They're overreacting. So things like dendritic cells or sample particles or compounds or mycotoxins or biotoxins or dietary proteins, they tend to be overzealous. So, the goal is to try to calm those down. And then the other key thing is distinguish. One of the most important parts of tolerance is something called regulatory T cell function. And regulatory T cell function helps to determine what kind of immune response you have or not response with a trigger. So the 3Ds stand for diversify, distinguish, and downregulate. I've also written articles about this at Dr. K News if you want to learn more about immune tolerance and dietary nutritional approaches to that. Dr. K News is drknews.com.
Okay. And then someone's asked, can you clarify mycopolysaccharides? I don't know where that came from. Maybe they didn't understand you?
I don't. Oh, it's not mucopolysaccharides. It's lipopolysaccharides. So let me clarify that. The question is, can I clarify lipopolysaccharides? Yes. So, bacteria in your gut produce compounds too, and these compounds are postbiotics, and these are called and these postbiotics are classified in a group called polysaccharides. There's some polysaccharides that really help our immune function, and there's some polysaccharides which really cause inflammation in the body. So, for example, there's some research that shows if we have healthy gut bacteria, some of the bacterial species in our gut produce something called lipopolysaccharide A, LPSA. And LPSA calms down inflammation throughout our body. It even has been shown in animal studies to regulate autoimmune flare-ups. And it's one of the benefits of having good bacteria, because good bacteria produce these postbiotics called LPS. However, there's also, what we term in a simplistic model as adverse bacteria. or in conditions of dysbiosis, when someone doesn't have enough fiber in their diet, all they're eating is sugar and unhealthy foods, their microbiome ecology changes, and they produce bacteria that produces their postbiotics that are actually lipopolysaccharides that cause inflammation. And those polysaccharides that cause inflammation can actually get into our bloodstream, especially when we have intestinal permeability, and that's called endotoxemia. So there's a lot of research in the immunology literature of endotoxemia from intestinal permeability causing inflammatory reactions all throughout the body, whether it's brain inflammation, cardiovascular inflammation, joint inflammation. There's a lot of that information that's been researched and published now, which is very interesting.
Okay.
Okay.
Kate, did you say NAC for increasing glutathione?
What's that?
Kate asked, did you say to use NAC for increasing glutathione?
Yes, you can use N-acetylcysteine to raise glutathione. Typical doses around 1,500 to 3,000 milligrams. So those are things that can be effective.
Okay. Boris, what is the best inflammatory... No, sorry. Okay, Kiara asks, a lot of people ask this, if someone has been diagnosed with mold and SIBO and candida, other symptoms, is it necessary to clear the mold before treating other things?
So the question is, if someone has like multiple conditions like SIBO, candida, should you treat the mold? Should you treat the mold first? Honestly, there's no clinical priority when it comes to real clinical scenarios. You got to determine what's there. I mean, the key thing with mold is if you're getting constantly exposed, that's a real issue. If you're constantly being exposed to mycotoxins and you have immune reactions to those, and you have antibody elevations to those mold species, and you have mycotoxin levels that are elevated or complement proteins that are elevated, that's an ongoing trigger for inflammation and chronic disease promotion. So that may be one of the things to be aware of. I will also warn you that there are a bunch of people that are so-called mold experts, mold doctors, and it's great that people specialize on something, but the problem is when you sometimes see some practitioners specialize on something is that everything in the world is now mold. So they just, let's say if all you have is a hammer, everything's like a nail. And they look at every chronic disease as being mold related. You see the same thing with people that are experts in Lyme disease. You see the same thing with people that are just focused on leaky gut or whatever the situations are. So that's another key thing to be aware of when you're looking into the healthcare system. Chances are, if you go to a mold specialist doctor, there's a very high probability that despite your chief complaints, you're going to be diagnosed as mold as your health problem issue. So be aware of that as well. Okay.
Okay, so Dee Dee asks, she bought your Why Isn't My Brain Working book, and she's looking forward to reading it, but it's in 2013. Are there any updates according to new research that you would...
Dee Dee asked, she read my book, Why Is My Brain Working? Oh, bought the book, hasn't read it yet, but are there any updates?
Yeah.
Most information in Why Is My Brain Working is still up to date and accurate. There's over 1,000 peer-reviewed references for it. So the only thing that's not mentioned in that book that I think a lot of research has come out since 2013 is how important intermittent fasting and fasting can be for the brain. More and more research has shown that that's one of the key ways to have a neuroprotective effect, and we don't really talk about that in the book. So we also have learned that ketogenic diets where people get into ketosis also have a very significant impact on brain inflammation. We used to just think it was a critical to use for an efficient energy source for seizures, but there's been some really good research that shows that actually when your body goes into a ketogenic state, that you produce ketones that actually have an anti-inflammatory effect in the brain, and that's really really exciting to hear. And then this is the reason where intermittent fasting comes in, and it doesn't really matter if it's every other day fasting or 18-6 fasting, where you have 18 hours of fasting and 6 hours of eating, or extended fasting. Those mechanisms produce something called autophagy, where you clear out debris. So I think if there's anything missing from the brain book that a lot of research has shown since that book was published, that would be it. Outside of that, everything else is pretty solid, even with new research that's come in, and it's still a very valid book to understand relationships that are involved with the brain. So that's why is in my brain working. I wrote that book, and then that actually led me to develop my first online program, which is called Save Your Brain Program, because a lot of people that were pushing the book, they got the book and it was like a huge brick, and they're like, I can't go through all this, my brain's not working. So that actually motivated us to create an online program called Save Your Brain. So I put together a program where I go into the key concepts of that book over a 6-week period each week, teaching how to implement different lifestyle strategies in order of importance, to really implement some of those concepts in the book. So if you're interested in that, that's also on drknews.com. Okay, next question.
Okay. Back Guitar asks, what do you use for gliotoxin testing?
Gliotoxin
testing. GIL.
Oh, I'm not sure what gliotoxin testing is, so I really can't comment on that.
How to test for endotoxemia. How to test for TLR4.
Okay, so how to test for endotoxemia and TLR4. Mm-hmm. So TLR4 is a receptor. You can't really test for that. All you can do is measure for endotoxemia. You can measure things called lipopolysaccharide levels, gram-negative lipopolysaccharides. That's done through a blood test. In my practice, I use Cyrex Array 2, which measures tight junction proteins, zonulin and occludin, and actually measures the gram-negative lipopolysaccharides that cause activation to those toll-like receptors. So that's one of the ways that's the way I do it in my office. I just measure Cyrex Array 2 to look at that. And when we look at like a panel like Cyrex Array 2, we have to look at occludin and zonulin. Occludin and zonulin are tight junction proteins that if they break down, you start to show abnormal levels on blood with antibodies to those proteins. But those proteins also are found in the lung barrier and in the blood-brain barrier and in the gut barrier. So when you see, occludin, zonulin abnormalities or tight junction protein breakdowns, and you see LPS, it could be from the gut or it could be from the lungs. They're all part of the same mechanism.
Okay. What lab tests can you have your doctor use to confirm mold?
What lab tests can you use?
Can your doctor order to confirm mold?
So the test we talked about is just an IgG or IgM antibody. If you actually go use the two largest labs in the U.S. are LabCorp and Quest, and they both actually have mold species panels for these antibodies. So they're available in commercial lab tests if you're working with your family physician to order them, and they're used to using the conventional laboratories that are out there.
Okay, Lee. If you are exposed to mold at work, can wearing an N95 mask help?
I'm not sure if a mask will help. I would assume that if you're wearing a mask, that you may reduce your exposure to some mycotoxins. That's just an assumption. I would guess yes, but that's just a guess.
Okay.
So the question I see here also from Marie is, do you see mold being linked with interstitial cystitis? Yeah. So a lot of interstitial cystitis is actually autoimmune and inflammatory, and there's been some people that have chronic interstitial cystitis where they keep getting the flare-ups, and they keep being tested for recurring bladder infections. It's not a bladder infection, it's actually just interstitial cystitis, and there's some research that there's autoantibodies to those target proteins that are causing it, and mold, like any other trigger that's inflammatory, can activate any autoimmunity. So there's I think a large number of women that suffer from chronic interstitial cystitis, and they don't really know that it's probably autoimmune, that they're having autoimmune reactivities to those proteins, like tropomyosin, which is antibodies to the smooth muscles of the bladder. And then anything, it's like for them, if someone has, for example, autoantibodies to tropomyosin, they get exposed to mold, they can express as their interstitial cystitis flaring up. For someone else, they may have antibodies to collagen or arthritic peptide, and they get exposed to mold, and the inflammatory response activates their RA. So that's the key thing about mold too, is that it just, again, adds fuel to the fire, because these mycotoxins add to this as well. I also want a lot of questions here about Dr. Shoemaker's work with chronic inflammatory response syndrome. I just want to say that he's doing great work with that. He's really looking at its own syndrome that's associated with mold toxicity, and I'm just talking about the basic concepts of mold, not associated with any specific syndrome or protocol. And in his scenario, it's not just about the reaction to mold, but it's just the inflammatory response that's taking place. So just to make that distinction there. But I think he has some great stuff. It's definitely worth looking into if you're looking into mold related issues. The only thing I would just say is, there's some degree of individual uniqueness you need to have when you look at mold exposures and toxicity. And sometimes a heavy duty protocol with lots of different drugs and VIP and those things are, I think, a little too routine and not enough personalized approaches. And also, I mean, there's just, with any model, any syndrome, if you look into, you can always find a little bit of things you disagree or don't like with. But for the most part, I think he's helping a lot of people, and that's great stuff. And more importantly, he's really working on getting some things published, and I think he's doing some good stuff out there.
Okay, Rebecca, there's a correlation between blood-brain barrier permeability and gut permeability.
Yes.
Is lung barrier permeability related in the same way?
So the question from Rebecca is that there's some correlation between gut barrier permeability and blood-brain barrier permeability. Mm-hmm. Is there a correlation with lung barrier? Mm-hmm. Well, I would tell you that we actually last year did publish a study in the International Journal of Molecular Science where we looked at people who have gut inflammation, and we found that it does cause gut barrier permeability does cause blood-brain barrier permeability, or is associated with gut-brain barrier permeability. We looked at correlation analysis. We found a high degree of correlation. We also did some risk ratio analyses and found that there was I don't know, there was 8 to 10-fold increased risk of having blood-brain barrier permeability measured by S100B if you have intestinal permeability. So that was a study that we did publish. I think we had about 400 subjects in that study. But there hasn't been any significant research making the correlation between gut and lung. However, they're the same proteins. There's a paper that was published by Fasano where he talked about, I think something like the title is Zonulin and Chronic Inflammatory Conditions and Autoimmunity, and he reviewed the literature of how zonulin is involved with lung barrier permeability, and a lot of chronic upper respiratory disorders have breakdown of that barrier as well. I pretty much think if you get exposed to an inflammatory source, your barriers are going to break down. The key difference between the lung barrier and the gut barrier is that when your gut barrier breaks down, it's usually more involved with chronic inflammation in the gut and from digestive proteins. The lung barrier is definitely more sensitive to environmental air pollutant compounds, whether it's mycotoxins or just poor air quality from air pollution. There seems to be that factor. However, the gut barrier, the lung barrier do communicate through these dendritic cells and different immune cells. And once you start to create systemic inflammation, all barriers break down. So just like the gut barrier breaks, just like the blood-brain barrier breaks down when there's gut inflammation, I would suspect the same thing happens to lungs, but I haven't seen that published anywhere. Anyways, I think we're out of time here. I hope this little talk on mold was useful to you and provided you with some things to think about. And thank you guys for joining us. I really do appreciate everyone's involvement and hope to have you join us when we do this again soon. Thank you.